Hi, everyone. Welcome to the Know Thy Shelf series on family medicine. My name is Annette Gawron, and I'll be the one hosting this family medicine series for you. I am a second-year pediatric resident. I work as a pediatric resident at Nicholas Children's Hospital in Miami, Florida. And I've been working with med school tutors for over 3 years now. I started in 2017. I've taught lots of different exams. I've taught for the USMLE Step 1. I've taught USMLE Step 2, Step 2 CS. I even do advising too for residency, and I'm also a blog poster. So I've done lots of things for med school tutors, and today I'm going to be your webinar host. So basically, this is kind of what we're going to talk about. We're going to talk about family medicine shelf exam, or the shelf exam, of course, but just the clerkship as an overview and clerkships in general as an overview. I know you guys, most of you are third years. You're going to be starting your third year rotations if you haven't already pretty soon. Some of you might have family medicine coming up next. Others might have it in a few months. Either way, I'm happy you guys are here. So I will talk a little bit about just clerkships in general, and in general, everyone's clerkships are going to be slightly different because every medical school is different, every hospital is different. We're also going to talk about study tips for all clerkships, or like a general view for clerkships and for, of course, family medicine. We'll talk about the different resources out there and our recommendations, what MSD recommends for you guys, as well as my personal recommendations. We'll talk about family medicine, some family medicine pearls that are very important to know for the actual family medicine exam. And we will talk to you, of course, about med school tutors and what we're about and how we can help you along your journey all the way to residency and beyond. Alrighty, so med school tutors, we are a team. We are a team of med students, team of residents, attendings. We have 14 years of success, one-on-one online tutoring, and we're here for any of your needs, any of your specific needs, whether that be shelf exams, studying for Step 2, CS, CK, applying for residency, all of that. So stay tuned. I'll talk a little bit about it later, but I really want to just kind of dive in and share my knowledge with you. So let's start just briefly. If you were lucky enough to be able to go to the hospital in this COVID era, in this weird time that we're in right now, that's great. And this is what your day is probably going to look like. And like I kind of mentioned earlier, every rotation is different. It's different depending on the hospital you're at, depending on the med school, the location, and the specialty that you are rotating at. So in general, family medicine can be outpatient or inpatient. If it's inpatient, it's going to kind of follow a schedule similar to this. And same with a lot of the specialties, pediatrics, internal medicine. This is more like the academic hospitals. These are the rotations at academic hospitals or academic focused, education focused hospitals. So basically, if you're in something like surgery, you're going to look at the earlier pre-round time, like 5 o'clock, 5:45, you're getting at the hospital to pre-round on your patients because you're starting rounds very early at maybe 7:30 or 8. For specialties like pediatrics or internal medicine, family medicine, it might be a little bit of a later start, something like 8 a.m. or 7 a.m., and then just having rounds start around 9 or 10. Basically, on your first day, on your first few days, it's better to go in a little early rather than later to pre-round your patients. You want to know your patients really well because you're going to be presenting that patient to your attending at rounds. You want to go through their chart, make sure that you know their vitals, their labs, and you're familiar with their diagnosis and their management and plan of action. And if you're working with residents, you should always feel comfortable approaching them and just like, you know, a lot of residents are happy to run through with a med student, just kind of quickly the plan for that day so that you have a good plan ready to present to your attending during rounds. Rounds takes about 2 hours, give or take. It's very attending dependent. Some attendings do table rounds and then they round really quick. Others do family-centered rounds. So you'll go into the actual patient room and and share, like present in front of the actual patients and their families. So it depends on your attending what they want to do. But most likely, especially if you're an academic teaching institution, you are going to be the one who's presenting in front of the attending and in front of the other team. And that team could be the attending and the residents, and it could also include other people like a charge nurse or a nutritionist or even a pharmacist, depending on what unit you're in. And then usually a lot of the teaching institutions will have some kind of noon conference or didactics around 12 to 1. You could usually, sometimes they'll serve food for free, or you could bring your lunch and eat there. And then after, you go back to the wards, back to the floor, help the residents with anything that might be pending or that they need help with. Always check in on your patients again in the afternoon. So I always say you want to see your patients 3 times during the day. Once, but when you pre-round, you want to see them and speak with them. Once during rounds when you're presenting, and then after to check in on them and see if there's anything that you need. And that'll really show to the residents and the attendings that you care about your patients, and you are following up and are eager to learn and do well during this rotation. Another thing that's important is to pay attention to the plan during rounds and then make sure that plan is followed up. Maybe there's an antibiotic change, or your patient's going for imaging later that day. Like, make sure that those plans are happening and that you follow that up, because sometimes the residents get so overwhelmed that they can miss 1 or 2 things. And if you're that medical student who's on top of it and just kind of reminds the resident or just kind of follows up, you could really make a big difference in that patient's care. And then between 5 and 9, I know that's a big span. Usually you'll be able to go home depending on the program, the specialty, the institution that you're at. Some institutions, I know mine does that. There's always a medical student on call each day until 10 p.m. So all the medical students go home at 5, or sometimes a little earlier, depending if there's an afternoon lecture or not. And then you have one resident who stays that day until like 9 p.m., 10 p.m. So it really varies depending. And so you go home, you exercise, you hang out, you eat some dinner, and then you have to study. And this is what makes 3rd year so different from 1st year and makes it a little bit more challenging, because you're showing up really early to the hospital. You're spending all day at the hospital. Maybe you could sneak in. A lot of the times you'll be able to sneak in some studying, but you get home and you're tired and you want to relax. And fitting in that time to study is hard, and it's a challenge, and it's something that you guys are going to have to figure out and kind of get used to and figure out like what works for you. So day in the life virtual clerkships. So unfortunately, we are in this COVID-19 pandemic. It is not ideal, but we kind of have to do what we have to do in this time, and we have to adapt. And the health of you as medical students it's very important. So if you do get, you are in a virtual clerkship, and I know at my hospital, all the 3rd years have to do virtual clerkships right now. Only the 4th years are allowed at the hospital. If you do have to do a virtual clerkship, just think of it as a positive thing. It does mean you have more time to study for shelf, so just use that to your advantage and do better on the shelf exam and really learn. It does have its disadvantages, of course. If you're interested in a field, you get less exposure. But remember, everyone else in this country is going through what you're going through, and you're not alone. And it's just temporary, and it's something we really have to adapt to. Most institutions, medical schools will have their specific ones. So you kind of have to go based on what your medical school is offering. So maximize your clerkship studies. Your time will be limited, like I mentioned. So really try to fit good time into studying and be efficient. Figure out a schedule. See what pockets will you be able to kind of fit in studying. For step 1, we had pretty solid resources that kind of everyone agreed on. So UWorld, of course. First aid for step 1, some kind of like pathology research, like resource like Pathoma, and then maybe like a sketchy farm and micro. For step 2, there's so many resources, so many more. There's just tons that you can choose from. And that makes it tricky, because more is not always better. Actually, less is more in this sense. So you want to pick out the resources that are best for you. maybe it's going to be different from your friend, but you need to figure out what is going to help you succeed the best. And remember, every shelf exam is different, and every shelf you're going to need different resources. And family medicine is pretty unique, one of the more unique shelf exams. So we'll talk about how family medicine is different and how you should approach this shelf exam compared to some other ones. And start early. So like I said, every institution does things differently. For my medical student, or when I was a medical student, my medical school did 6 weeks rotations. So I had 6 weeks until my shelf exam, because I always took my shelf exam at the very end, as did most medical students. And I would use like the first week and a half to 2 weeks to kind of get into the hang of things, just kind of enjoy my rotation, feel out like what this rotation's about, what are the attendings like, am I working with residents, like what are the residents like, and just kind of like enjoy the rotation and kind of get a sense like, is this a specialty that I can see myself doing? Is this something that I would enjoy? And then after about a week and a half, 2 weeks, that's when you want to like figure out your resources. What resources am I going to utilize? Which one, kind of do my research, figure out like, okay, I'm going to utilize this, this, and this. And then I start studying like right at the 3 week mark, so that I have a good solid 2 to 3 weeks where I'm doing lots of questions and using the other resources that I determined are best, and then just creating a study schedule and sticking with it. Okay, so question, what are study strategies that work for step 1 that do not work for step 2? So biggest thing is the time. I mentioned this before, it's step 2 CK is a totally different game because you are working Monday through Friday, even sometimes going on the weekends, sometimes doing like late nights. And you didn't have to do that in step 1. In step 1, you had a lot of time to study. You had a lot of designated time to study, and you could utilize all these different resources and watch videos and do all these different things. But in step 2, you have to be very selective with your resources and figure out what you want to do and just go for it, and do like less experimenting and just kind of jump right into the studying. So find pockets of time to study. So I kind of mentioned that before. You will have time during the day if you pre-rounded on your 2 to 3 patients that students tend to carry, and the attending's running late, or maybe you're just efficient that day and your patients aren't super complex, you might have some extra time and you can read your case files or do some UWorld questions on your phone, or if you bring your laptop, you could do it on that. My recommendation would just be, if you do have residents, just be close by so that if they need help, they can ask you. But a resident will never look down upon you for studying. We understand, we've been there, we know that your time is valuable, we know you have shelf exams that you're studying for, and so don't worry about that. Just be available if a resident needs your help, assuming you're working with residents, because not every rotation will have residents. If possible, try to link didactics, cases, meet patients that you're seeing while you're shelf studying. This is awesome. This is a great way to really learn and master the material. Let's say you have an older woman who comes in with a hip fracture. So you could read all about like DEXA scans and bisphosphonates, and kind of link that information with that patient that you have that day, and kind of understand the management. And that helps you solidify that information. Of course, we're not going to be super lucky and always have a patient to go along with everything that we're learning, but it definitely helps when we do. Stay connected to those who provide support and accountability. Clinical years are hard. Everyone kind of says, oh yeah, rotations are so much easier than first and second year. And that's not always the case. You will have hard rotations. Burnout happens in medical school, and it happens in your clinical rotations. And you want to be around people who are going to support you and understand that, it's hard. It's hard to go to the hospital. It's hard to spend all day there and then go home and study and have to do well and perform well on your shelf exams and your USMLEs. So be around people who are supportive and understanding. And it also helps to be around people who are studying also, so that they can provide some accountability to you. Keep an eye out for institution-specific resources. Different hospitals have different lectures that are helpful, and then each shelf exam also has their specific resources as well. And then remember, too many resources can be problematic, as well as too little. So you really want to just figure out what's going to work for you. Pick just a few of them, a good number, and just really utilize them effectively and efficiently. So UWorld, you guys are very familiar with UWorld, I'm sure. UWorld is an excellent resource in general, but throughout all of your second year. In general, you want to have a goal to finish and go through UWorld one time through before you start studying designated for Step 2 CK. And for most of your rotations, you are going to utilize UWorld. Family medicine is actually kind of the exception to this rule. And I will go into that a little bit later. But in general, UWorld is great and you want to use it. And you especially want to use it for things like internal medicine and pediatrics and the ones that have like subject, like specialty specific subjects. And as you can tell, family medicine there is no family medicine specialty when you open, like subject, when you open UWorld. So we'll talk about that in a little bit. But make it a goal to get through all of those specialty specific questions by the time you get to your shelf exam, depending on the shelf that you're taking. And also fun fact, I kind of mentioned it before, you can download the app on your phone and access questions on your phone. And so that's super useful when you're at your rotation, you want to like sneak in some quick studying. And then another thing, pro tip, make flashcards. I love Anki. I've always used Anki. I used it for step 1, I used it for step 2, I used it for step 3. I personally made my own flashcards when I would come across tough, challenging UWorld questions or questions in other question banks. And I would make it like vignette style, and then on the back, kind of a quick blurb. So just like a shortened version of the vignette, and then the high yield points on the back. And then I would study that throughout the week, and then especially leading up to my exam, because it would kind of help me get through a second time through the question bank without actually having to, put in the time and the time commitment to make a whole second round through a question bank, which is very time consuming. So that way it kind of highlights like those main high yield points that you really want to focus and kind of like relearn, especially when you get the questions wrong. And then, but there are other flashcards. Anki also has pre-main flashcards. There's Memorank, and then UWorld has the flashcards, and I think they're really great. You have to make them, of course, but I make them for the high yield images, especially the dermatology ones. And I also make flashcards of the important tables and charts that I come across for UWorld, and then I review them just as I would my Anki flashcard deck. Case Files is an excellent book resource. Most of them are about like 60 cases, depending on the specialty, and they just go into a case, describe a patient, and then go into the details of the diagnosis, the treatment, the management, those kinds of things. And it's really nice when you're on rotations, because a lot of the times patients that you see on the wards in that rotation will come up in your case files. And it's just really good. And for family medicine, Case Files is an excellent resource. So let's talk about the family medicine resources. Notice I do not have UWorld under main resources. And the reason for that is, although UWorld is phenomenal in so many ways, there's a lot of questions, and there's no family medicine specific section. So you could go ahead and do internal medicine questions, but that's close to 1,000 questions. That's so many questions. And a lot of those questions are very inpatient focused. And even though you will see inpatient questions on family medicine, it's much more outpatient focused questions. So I personally think that it's too much to go through and it's not focused enough. There are other options for question banks. The one I used when I was a medical student was Exam Guru. That's not actually one that you hear too much about, but I used it and I thought it was phenomenal. I loved Exam Guru. I thought it was for family medicine, and it was the only shelf exam that I used Exam Guru for, and I thought it was 100% worth my investment. It's not cheap, it's $37, but I personally invested my money into question banks because that's how I learn. And I think that in general, question banks are kind of the way to go, because you're simulating what a shelf exam is going to be. You could time yourself, like do your time blocks, but then you also learn a lot from the questions, and then you remember the questions that you get wrong and you retain that information more. I think is a very active way to learn. But if Exam Guru is not, like, you don't really want to invest that kind of money, there are free family medicine questions. The American Academy of Family Physicians has over 1,000 family medicine board questions available on their website. You just have to create a free membership, and then you have access to those questions. Just remember that these are family medicine board exam questions. They are great, but because of that, you are going to come across some questions that are a little bit above your level, especially things like dosing. So just be cognizant of that, and try to be aware of what questions might be a little bit beyond your level and not as high yield for your exam. And then I put case files there because case files are just very good for family medicine. I recommend just either buying it, or if you don't want to buy it, there's a lot of medical students have just PDFs floating around. So if you could get your hands on a PDF, that's awesome. And if you have an iPad, or even pull it up on your phone when you're in your rotations and just read a case a day or 2 to 3 cases, make a goal depending on how many weeks your rotation is, and try to just run through all of them. Maybe take little notes or add little flashcard. Like if you're using your Anki decks, you could just kind of make a quick flashcard blurb on each of the cases and like the high yield points. It's really nice. And then there are NBME self-assessments, which are excellent. They also cost money. It's about $20 each. A lot of people, medical students, do not utilize it. I personally took them for all of my shelf exams, and I thought they were great. They gave me extra questions for me to do that were family medicine focused, family medicine based, or whatever specialty I was doing. And then I also got to see how well I did and how well prepared I am at this current state for taking my shelf exam. And I noticed that I would take them like a couple days, like about a week to a few days before my exam, and they were pretty accurate representation of how I ended up doing on the shelf exams. Other resources, Anki flashcards, we kind of talked about. US Preventative Services Task Force, they have, I dropped the link there, but you can easily Google that and read through this 2-3 times before your family shelf exam, and has all the screening recommendations that are super high yield. So highly, highly recommend doing that before your exam. And then vaccination schedules. Know your adult vaccination schedules. Very, very high yield. I had many questions. I want to say at least 5 questions on my family medicine shelf exam. And I took that a long time ago. So if I can remember that I had like that many, like it must have been a lot, you know? And then other resources. So you have online med ed. People love this online med ed. If videos are your thing, go for it. AMBOSS is kind of a new thing for step 1. It's big. It's there's also available for CK. It's kind of a detailed, a high yield like summary of all of the main topics. So you could check that out. Step Up to Medicine. A lot of you probably already have this book in preparation for your internal medicine rotation. And if you do, try reading the ambulatory medicine and dermatology sections. Those are, I would say, the most pertinent for family medicine. UWorld. So we talked about UWorld. You can still utilize UWorld. Absolutely. If you do utilize UWorld, try to go through the MSK section. MSK is super musculoskeletal, super high yield for your family shelf exam. Family medicine shelf exam. So try to get through those, and dermatology if you do want to use your UWorld. That will be the best for you. And then use that on top of your like other question banks that you might use, or your practice and BMEs. And then I also added first aid for step 1. I don't know about you guys, you might totally hate first aid, never want to think back and remember your step 1 days, and that's fine. But if you're like me and you have a very special place in your heart for first aid step 1, you should continue to utilize it. I used first aid for step 1. I used my first aid step 1 book for step 2. I just took step 3 about a little over a week ago, and I used first aid step 1 for that. And I still use it for my rotations in my residency. I just love my first aid book. I think it's so excellent, so awesome. I think it's better than any of the books like out there. I never actually tried the first aid for step 2 or any of those. I always use my step 1 one. I actually have the 2018 PDF that I would utilize, that I utilize now. I'll just search things really quick, and it kind of gives me like a quick overview, basic science review, and it's still really good. And it even first aid for step 1 has like a little bit of management. So if you loved your first aid book, keep it going. It's worth it. It's super awesome. And then just an overview to kind of see like what is on the shelf exam. There are about 110 questions. 90 of them are just core content related to family medicine. 10 is chronic care, and then 10 is musculoskeletal. So there it is, MSK, high yield, know it. Read in your step up to medicine if you have it, do it in UWorld, and just know your MSK. Read it over it in even first aid if you want. And then the breakdown, so you can see there is pediatrics, there's geriatrics, there's obviously adult medicine, and there's OB-GYN on there too. And you do want to know your pediatrics and OB-GYN, but not to the extent that you need to for the other shelf exams. So that's why doing like a family medicine focused like Qbank is helpful, because then you can kind of brush up on the high yield portions for those topics. And then task-wise, we have health maintenance. So those are that 15 to 20%, that's your screenings, your vaccines, your recommendations for like preventing diseases. Super high yield. Understanding mechanisms like pathology, pathogenesis, diagnosis is really big. So that's also like a lot of step 1. So that's where your kind of first aid step 1 comes back. And then principles of management. That's what's new for you guys in 3rd year, like management, like step 1, not less management, step 2, lots of management. So this shelf will test you on your management. And then as you can see, we have lots of different organ systems that are covered, and I bolded musculoskeletal because that one is big, very like high up there. All right, and then some study tips. I kind of already mentioned it. We're less emphasis on basic science, still need to know it, but way more on the management. And make sure you know your vaccine schedules and your screening recommendations. Very, very important. If there's anything you do to study for this shelf exam, please, please, I beg you, know your vaccines and know your screenings. So let's talk about some pearls. So of course, I just stressed vaccine and screening. So our pearls are gonna be our vaccinations. So we gotta know it, all right? So if it helps you draw it out, make a chart, a graph, whatever you need to do, learn it. So influenza every year. Once you turn 6 months, you do it every year. For herpes, herpes zoster, so shingles, we vaccinate starting at, well, actually it's technically approved for age 50 and above, but the recommendation is that once we hit 60, we want to start vaccinating. HPV, we vaccinate both males and females, preferably now 11 to 12, around that age, but we can go all the way up to 26, and that's really important, especially for females, that you can get a question and the patient is 24 and she never had her HPV vaccine. That can be an answer to one of the questions, because you need to know that 26 is the cutoff. So they could be really tricky with these questions, and knowing the exact time frame for these vaccinations are very important. Meningococcal, we do it every 5 years in our very high-risk population group, splenic patients, HIV patients, patients with complement deficiencies, or taking really a strong like different like medications, like complement inhibitors, etc. And of course, our college students, anyone who's going to be in a dorm for sure, and military recruits, and then even like scientists who might have extra exposure to Neisseria meningitis, or maybe going to like a area where it's endemic. Those are people you might want to consider vaccinating too. Tdap is a big one. They love playing with this one because this one just has so many like ifs and buts and whatnot. So we like to give, so DTaP is the one that's given to are pediatric patients. Those are as part of like the pediatric immunization. And then when you're older, after you're 7, then you get your Tdap. So before 7, so 6 and younger, you're getting your DTaP. So capital DTAP. And then after 7, then you could get your Tdap. Preferably, we give our adolescents at like around 11 to 12 our first Tdap. And then after that, every 10 years, we give them a booster. So the answer on a test question is usually the booster if they have gotten the Tdap before, think after they were 7, like 7 or older. If they got it once in their lifetime, then you go and you give them boosters every 10 years. If the patient tells you that, oh, I don't know if I ever got my vaccine or not, then you give them a Tdap. Okay? And the importance of that is that it includes the pertussis, and pertussis like can come back and you can lose your immunity pretty quickly. It kind of just fades over time. So that's why they recommend the Tdap at least once, and then after that we can do our boosters. And then we also would always give it in pregnancy as well. And then this one, very high yield, also shows up. May or may not have had a similar question on an exam I recently took. So make sure you know the indications of when you need to give your your tetanus shot and an immunoglobulin, or one or the other. Know it. And basically it varies whether the wound is dirty or severe, or if it's a clean wound or cut. So a dirty wound, think of maybe like falling off a horse, or like falling into a dirty stream, or cutting yourself on a really rusty nail. That's what you're thinking dirty of. All a clean would be something more minor, maybe something that happened in your house rather than an outside environment. And so if you are unimmunized, or you're not sure about the status and it's a dirty wound, then we give both. We give either the Tdap or the tetanus booster, and we give the immunoglobulin. If it's a clean one, we only give the vaccine. If you've had your vaccine already within the last 10 years, that's fine for clean wounds, but it has to be within 5 years for the dirty wounds. And they can be really tricky, and they could say, this person fell off a horse into like dirt and she got her vaccine about 7 years ago, was her last booster. What would you do? What's your next step in management? And the answer would be you have to give her a vaccination, since it was within the time frame. And then pneumococcal, very, very, very high yield. They love this one because this one, it's just like tetanus. It's easy to like trick you trick the students. So they love the tetanus and they love the pneumococcal one. So make sure you know those like the back of your hand. For pneumococcal, the way that I remember this is, so there's 2, right? There's the 13 strain, and then there's the 23, 13 valent and the 23 valent. The 13 valent, think about it, that you get that when you're a kid. Those are part of your childhood. And then you go ahead and get your 23 later on. So if you're at high risk, meaning you're between 19 and 64, and you're at risk, but you're not super high risk, then you would just go ahead and get your next one, right? You got your 13 as a kid, now it's time to get your 23 between 19 and 64, because you're a little bit higher risk. So that's like chronic heart disease, lung disease, liver disease, diabetes, or diabetics, smokers, alcoholics, whatever. So a little bit higher risk than the general population. But if you're very high risk, and these are like our sicklers, our A-splenic patient, our chronic kidney disease, our CSF leaks, that think about like they're so high risk that they need to get another childhood one and then get the 23 on top of it. So that's how I remember it. And then once you hit 65, think about it. It's been so long. It's been 65 some years, like 60 to 65 years since you had your childhood vaccine. So you got to start it over. So you get your 13 and you get your 23. That's the way that makes the most sense in my brain to help myself understand that. And it's easy to forget. So just kind of relearn it and really like cram this, especially the night before the exam, so you don't forget. Alrighty. And then finally, my last section on our family medicine pearls is our screening guidelines. So I took these from the task force. You could just Google that, the US task force, A and B recommendations. And these are the ones that I have just through my experience studying for step 2 and step 3 are the most high yield to know for your family medicine shelf exam. So abdominal ultrasounds, men, not female, just males. This is all based on evidence. So if you're curious why, it's just they've done a lot of studies and they just found it to be way more effective in men for it to be worth it. So if you have ever had any kind of smoking history and you're between the ages of 65 and 75, you got to get an abdominal ultrasound to evaluate for abdominal aortic aneurysms. Mammograms every 2 years starting at age 50. But you're allowed to start a little bit early, just if like in your like around 44, 45 if you want to, but the recommendation is 50. So always follow what the recommendation on our task force, US Preventative Task Force, what they specify. Pap smears, they love the pap smear one. At age 20, they love to put pap smear as an answer choice for a female who's 18 or 19, and you need to know that it's at 21. I don't know why they love that. So you need to know that at 21 is when we start pap smears. We do not do them earlier. And then once you hit 30, then you have the option of just doing every 5 years high-risk HPV testing along with cytology or not. But the pap smear one I think is more high yield. PSA screening is not recommended. This is not actually under the task force, but I just studied for step 3 and they love to ask that too, like throw in like, oh, you should screen for PSA. We don't screen PSA. We only check PSA. So that's our for like checking our prostate, only if we have concerning symptoms of like BPH or prostate cancer. Colonoscopy, we start at 50 and then we up until 75 every 10 years, unless your GI doctor says otherwise. And oftentimes they'll recommend maybe they didn't have a good visualization when they were doing the colonoscopy, or they found a polyp or something. They might say like, okay, maybe get your next colonoscopy in the next 3 years or 5 years, but maximum 10 years. It's never going to be more than that. And then of course we need to do our low dose CT scans. This is between 55 and 80 in anyone who has a 30-pack year smoking history and are either current smokers or quit within the last 15 years. All right, so that wraps up our pearls. We're gonna jump into the Q&A soon. I know that a lot of you guys are messaging already. I see that. I can't wait to answer your questions. But I just want to, before I go on and move on, I want to just say that you guys have made it this far. You've gone through first year, you've gone through second year. Those are challenging years. Most of you have taken step 1. I know some medical students, they don't take their still step 3 or until year 3, until at the end of year 3. But you've made it this far. You are now transitioning to this exciting part of your careers. You're going into rotations. You are finally going to be able to take what you learned in your first and second year and apply it and see how that knowledge helps our patients and how we manage and how we take care of our patients, and also to just see what the healthcare system is like, because it's really eye-opening. There's so much about the healthcare system you just don't know until you're there and you're actually on the floors and you're learning and managing patients. There is a light at the end of the tunnel. You will do this. You got this. It is hard. Rotations are not easy. Burnout is real. You'll feel it now. You'll feel it in residency. But just know that you have a purpose and you're doing good things, and it does get better, and you learn, and just take every day as a new day, a new opportunity to learn and make yourself better, so that one day you're a better doctor and you can really help the lives of your patients. And be confident, trust in yourself. You can do this. I believe in you. Our med school tutors team believes in you. We know that you can do this and you're going to be great. While I'm just kind of waiting for people to just send in their questions, I'll just kind of talk about med school tutors again. The reason that med school tutors exist is for you guys. We found a need. We saw that students had certain things that they struggled in, and that was unique to each student. And so Med School Tutors was created to help every student figure out what their individual need is and help them get better and identify that and come up with like a plan to be better and be better doctors. So maybe you don't need help with family medicine. Maybe you're applying to surgery, and surgery is super important to you and you want to just do super well on your surgery shelf exam. We're here for you. We're here to help you with that shelf exam. And we're even here to just meet with you for an hour and help you come up with a strategy and a study schedule to help you reach your goals. And maybe you'll need help for CK, or maybe you're applying to a really competitive field and you just want some residency advice, what you should do to make yourself competitive for those fields. We have all of that for you and we're here for you. All right, so question and answer time. So please don't be shy. I am here. I would love to answer any questions, even comments. If anyone's excited about family medicine, I want to hear it. So aren't there only 90 questions total on the family medicine shelf? There are 3 different types of family medicine shelf exams. So one is 90, one is 100, and 110. And so I think when you go back to my slide, I had like the different cores. So I think it's based on those, which ones you did decide on taking. And I know each institution requires it differently. For my school, the year before me didn't even have to take the family medicine shelf. And then my year we were required to. Did you keep up with Anki reviews from earlier rotations throughout the year leading up to step 2? Awesome. Yeah, that's a great question. Yes, I did. I thought I actually did do that. When I had my Anki decks, every shelf exam that I came across that I was studying for, I made a new deck. So it was like family medicine, OBGYN, pediatrics. And so for each shelf, I would study that. And then when I was getting closer to CK, then I would start going through the decks like one by one. Like maybe this week I'll do the pediatric ones. Next week I would do. And then when I was actually doing designated studying, since these were questions based on the UWorld questions I had done that entire year, I actually didn't have to make as many for my second time through, and I was way more efficient with my time and could just go through my questions and then not make cards because I had already made it throughout the year. Any tips for when you are at the end and feeling burned out? Oh, great question. Burnout is real. Like intern year for me was very difficult. I have never felt depressed in my life. I have never, I am very positive, very happy person. And I have, now I know what it feels like to be at a low and a low. And that's all because of burnout. And you can read it. The studies out there are insane. Burnout is crazy. The suicide rate for physicians, including medical students, is crazy, okay? So my tips are, well, first of all, I just want to tell you, you're not alone. I also want to tell you, it's not your fault. And don't make anyone make you think like it's your fault that you need to be doing something that you're not working out enough, or you're not eating healthy and you're not getting enough sleep. That is, I'm sorry, it's not true, okay? Burnout is like an institutional problem, and it's a problem that nationally organizations are trying to fix. So first of all, my first tip of advice is accept it. It is a real problem and it's okay. And it's normal to feel that way. And there are resources to help you. And if you do feel like you're sad and you need somebody to talk to, don't be afraid to reach out and for mental health resources or talk to a therapist. Surround yourself around positive people and figure out what makes you happy and fulfilled in life and do those things. Whether that may be going on a walk. One of the things that I loved was just going outside. For some reason, that was just something that really helped clear my head in residency, and it really helped. And then being around those that I love, my family, my friends, my fiance, and then my animals, and just, cooking. I found a new love for cooking during intern year. So just kind of experiment and figure out things that'll make you happy, but know that you're not alone. And sleeping does help, even though it's really hard to find time for sleep. But if you can just be strict with your sleeping schedule and go to bed early so that you're getting at least 7 to 8 hours, it does make a huge difference on your like total mood. How many UWorld questions is realistic to do per day? Realistic, it depends. So it depends on like if you're going to be at the hospital until like 6 o'clock that day. If you're going to be there like all day and you get home at like 6, then I would say realistically 10 to 20 questions that day. If you have the full day to do questions, between 40 to 60 in the beginning, and maybe you could fit in 80, but 80 is kind of pushing it unless you're really like focused and are like really used to like running through UWorld questions. I remember for step 1, I was going through 60 to 80 a day. When I was studying for step 3, I couldn't really get through 50 questions. So know yourself, know how long it takes you to do questions. Remember, you don't want to rush through questions. You want to take your time, be effective and efficient, but like really utilize each question, really learn from the questions that you do, because at the end of the day, quality is better than quantity. So essentially what I would recommend, if you have 3 weeks, take the total amount of questions and divide it by the amount of days that you have and aim for that. If you don't get through all of them, don't beat yourself up, but my recommendation is at least shoot for like 90% to 100 of the question banks. Do you take notes of wrong questions? It takes so long to go over. Yes, so it does take time to do the notes. And so my alternative to my note taking is my flashcards. That is my note taking, because the Anki flashcards are online. So I type my flashcards out. So I save a lot of time. And those are essentially my notes. And then they shuffle, like Anki will like shuffle and schedule out different flashcards, or you could just do a random and like just go through all of them all at once. So that's my version of taking notes. I used to do a lot of note taking. I used to draw lots of beautiful, gorgeous diagrams for when I was studying for like M1 and M2. And then when I got to step 1 and step 2, I've done less of that because it's way more time consuming, and I've done more flashcards. But just remember, when you do your flashcards, make sure you're not taking or spending way too much time on making flashcards. You want it to be a quick summary. If you are doing vignette style like I do, just a quick summary. Use like abbreviations, only focusing on the main points of the vignette, and then just the high yield blurbs on the back. Do I take notes of my wrong questions? So for wrong question, oh yeah, so that was the same question. So I do take notes, and notes as in I make flashcards, not necessarily for just my wrong questions. I do them for both the questions I get wrong and maybe a question I got right that was challenging and I felt like I didn't truly understand it, or I felt like I could use a brush up, like a refresher on that topic. We are kind of running out of time, but there's one more question, so I'll answer this one. It'll be the last one. If you guys have any other questions after this, remember, we are here for you. Med School Tutors is here for you. Feel free to give us a call. We have a team that's willing to just chat with you and just talk to you. I mean, these are complimentary phone consults, so you can kind of just ask us all the questions that you have, and we're willing to like figure out what we can do for you specifically. So last, is there a maximum number of flashcards you recommend per wrong question? I actually recommend 1 flashcard per question, no more, because then you're just going to have like a deck of 600, 700 questions, and that's just too much. So to give you an idea, when I was studying for all of my exams, but specifically step 3, because that's my one I just took, I would only do 1 flashcard per question I got wrong, and maybe 1 flashcard per like question I wasn't sure about. So in total, I had 3 decks, because I don't like to have 1 deck for all of my flashcards. So once I hit like the halfway or the 1/3 point, I started a new deck. So I had about 200 to 300 per deck. So my first deck was the first half of UWorld. My second deck was the second half of UWorld, and my third deck was the questions from the UWorld self-assessments and the MBMEs, and anything else that I if I redid a question here or there and I came across something tricky or just wanted to like give myself some extra knowledge, then I would make a card there. And then I had another deck that was just pictures, because you could put pictures in Anki. So that would be like my derm pictures and like different high yield question, like pictures that I just didn't didn't feel like I knew well. Lichen planus, that one was one I would have to study. Different chest x-rays so that I would feel comfortable recognizing like a tension pneumo, which is like not hard to know, but like I'd rather just know it so well that it's like when it comes across on the test, I just don't even think twice. And then random and timed during dedicated, yes. During dedicated, but not necessarily for shelf. All right, everyone, thank you so much for listening to me. I love sharing my knowledge with you. I'm so happy that you guys had so many questions. Just remember, you guys are doing awesome. You're gonna be great physicians. Believe in yourself. And if you ever need help, if you ever need anything, we're here for you for your specific needs. So thank you very much. It was a pleasure presenting to you today and answering your questions. Thank you.